Okay, are we ready? Almost, okay. Okay. Oh, I don't know if we're going to get sound, which is kind of disappointing. Okay. What is the mechanism of action for garlic? It's a 20-second timer. There we go. Okay. So most of you got it. Some of you said inhibits cholesterol absorption. Not quite. Not quite. Are any of the supplements that we looked at do they have anything to do with cholesterol? Yeah, some of them do. Which ones? Red yeast rice is kind of associated with cholesterol in the fact that it does what? Yes, which statin? Lovastatin. It's monocyllin K. I didn't put a question on that in here, but you can expect a question on that. One of the other supplements has something to do with cholesterol. Fish oil. What does fish oil do for cholesterol? Or what component of cholesterol? Decreases triglycerides. Okay. Let's see who's leading. Nesty. Which supplement is known to inhibit platelet aggression? And may increase bleeding, especially with anticoagulants. There's a lot of options here. This should be a good warm-up question. They get more challenging. This shouldn't challenge you. Okay, so hopefully you're like, bleeding, anticoagulant, G, right? I was good and only put one up here. This could be a select all. Maybe it is later. Right? Maybe it is later. Milk thistle was the next guess. Do you remember what milk thistle was for or what people used it for? This is the one where it's usually used for liver support but can cause liver damage. Like that one, the liver support but can be liver damaging. No one said you couldn't. Okay, Cam is winning. Who's Cam? Okay. This is the hard part. You make these names and I don't know who you are. Sometimes. Which supplement is known for reducing triglycerides? Jose, you better have done well with this one. Okay. Fish oil. Good, because we literally just said this. We just talked about this. I'm just going to assume whoever did garlic just mishit the key. Because sometimes you're just happy and hit the wrong one. Okay, who won this one? Oh, Shauna's still winning. Who's 5Gs? Oh. True or false? Melatonin is possibly effective for jet lag. Okay, this is true. It's possibly effective for jet lag. A little moving here. Okay. Which supplement used for nausea may cause gastrointestinal discomfort? Maybe this is why. Ginger. Okay. So in this case, echinacea is for immune support. Butterbur, do you remember what that one's for? It's like migraine prevention. Cranberry, UTIs, and ginger, nausea. Yeah. Okay, I hear it now. I had my computer on mute. Maybe that's why. Let's see. What is the primary use of echinacea? There it is. I got it. Okay, good. We just talked about this. What is used for sleep aid? Melatonin. Okay, Jess is coming into the picture. True or false? Ginkgo is safe to use with anticoagulants. This should be easy. Oh, thank goodness. I'm relieved. Okay. What does turmeric primarily help with? Cognitive function. So it's not cognitive function, it's inflammation. I just read that first. Inflammation, turmeric, inflammation. Multi-select, get ready. Select the supplements that may increase bleeding risk and should be avoided with anticoagulants or antiplatelets. This is harder than you think it is. Unless you're looking, you might not have gotten all three. You probably knew fish oil. You probably knew garlic, but you probably didn't know saw palmetto off the top of your head, but now you do. Ooh, El Supplemento coming in. Okay, so here's a quick review of this. So we have ginkgo, garlic, ginseng, glucosamine, ginger, 5 Gs. Then we also have fish oil, saw palmetto, alpha lipoic acid, ancient ginseng, and the evening primrose oil. All of the supplements that can interfere with anticoagulants, antiplatelets, and warfarin. Which supplement is used for menopausal symptoms? Ooh. Okay, black cohosh. What is ginger used for? Nausea. What is peppermint used for? IBS, GERD, stomach too. Not very good at it. What's cinnamon used for? Diabetes. It's usually used for blood sugar control. Ooh, 5G's coming in. Who's 5G's? Oh yeah, Jesse. Who's Nesty? You're pretty high up too. Oh, Nesty. That makes sense. True or false? Saw palmetto is effective for male pattern baldness. Ooh. There's a key word in this to help you. False. The key here is effective. There was only like one thing that we saw as effective.
It's even not effective for CrossFit. It's used for that.
So good question. Good. You're still in the saw palmetto category. When we're looking at the categories that natural medicine rated things, there was very few that actually said they were proven to be effective. Most of them were possibly or likely effective or ineffective. Fish oil for triglycerides is effective. A way to remember that. It has a prescription form. That's how I remember that fish oil is effective for triglycerides, for lowering triglycerides. The rest of them are either possibly effective, likely effective, possibly ineffective, likely ineffective. One of those. Or not enough evidence. Yeah.
Possibly stronger than likely.
Yes. But also, yeah, that's confusing. So insufficient evidence for hair loss may be ineffective for BPH. So that's the other part of this to remember, is that when you think of saw palmetto, you often think of BPH because that's what people reach for it, but it's which is possibly ineffective. More likely that it's ineffective for BPH. And there's not enough evidence for most of the things except for outcomes of TERP. What is this?
We can react to
it. Okay. That's fun. I just see this like popping things coming out of the corner of my eye. What is the mechanism of action for valerian? Even if you look at these, you're like, who would want to do some of those? Hopefully you're like, who would want to increase your heart rate? Why would you want to do that? Who would want to stimulate your appetite? Some people do, but not most people. So you might have gotten it down to inhibiting serotonin. We didn't really talk about that with this one. This one is that acts on the GABA receptor.
Relaxation.
Yeah, the valerian is for relaxation. We'll have more valerian questions later. Okay. Which supplement is used for digestive disorders? This might be easy. Some repeats in here to see how well you can remember them. Okay, what's elderberry for? Immune support, mostly specifically the evidence is shown possibly effective for prevention of influenza specifically. Colds in general was not conclusive. Echinacea is also immune support. It's one to help before the cold. Ginkgo is for memory. Peppermint is for GI. I think so.
Like the nootropic.
The nerd, yeah. There's this whole supplement thing can get much more advanced if you really want to specialize in it. I keep it pretty surface level of must know, but it can get much more advanced. like neurotropics. And yeah. What is that one that's made from? I should clearly use it because I'm completely drawing a blank, but there's like made from sea fish or something like that. Do you know what I'm talking about? The memory enhancing supplement that's all over all the time. I'll think of it and tell you. I'll look it up while you're doing this question. You'll probably be like, oh yeah, I've heard this. I've heard this. A patient on warfarin should be cautious with which supplement due to the potential interaction for increased risk of bleeding. Uh-oh. Not one of the ones you expected. Okay. So in this case, it's cranberry. What do we mostly use cranberry for? UTI prevention. Okay. The one. Who is the one? That's a new one. Okay, Jose. The one. True or false? Elderberry is effective for treating colds. That should tell you a lot. Right. What is the key word in this? Effective. So elderberry is possibly effective for influenza. Insufficient evidence for any of the conditions used including cold, flu, which interesting, boosting the immune system or reducing inflammation. So there's a lot of conflicting evidence. Most of the time it's sure use it, but I don't know if it's going to do what you want. What was the other thing about elderberry? Do you remember the big caution? You don't want to eat the elderberry raw, right? Do you remember what it was the risk of? I think it's the cyanide one. Yeah. The two things that you don't want to eat raw, the ginkgo berry and the elderberry. I think the supplement that I'm thinking of too is Nervive. I'll keep looking. True or false? Coenzyme Q10 is used for heart health. True. So when you think of coenzyme Q10, what do you think of? Say that again. I still don't know what you said. Q10. QT interval. Oh, okay. Okay. There you go. The other. What? Oh, okay. Okay. 8. Okay. Great. Those are all great. I was thinking of statins. Totally different pages. It's okay. What is a common side effect of St. John's wort? Okay, so photosensitivity, and that one's important because that can be pretty not fun for patients. We're going to talk about St. John's wort more again later, but when you think of St. John's wort, what's the first thing you think of? Okay, that's a good one. What else?
Lots of interaction.
Yes, lots of drug interactions. But it is also for mild to moderate depression. What? Okay. What is the potential risk of high doses of fish oil? There's only one that's a real risk, people. Right. So it is still an oil. It is still a lipid. So if you do lots and lots and lots of it, you could increase your LDL. And if you didn't know how to read this question and you're like, I have no idea, improved digestion, reduce anxiety, enhance memory, all sound like good things, not risk factors, right? Which supplement is known for its antioxidant properties? Ooh. Okay, so alpha lipoic acid is often used for it lowering blood sugar, but it has antioxidant properties. What's valerian? When you think of valerian, what do you associate with that? Relaxation, over sedation sometimes, GABA. Elderberry is immune, but also specifically influenza. Cinnamon, diabetes. True or false? Milk thistle is used for liver disease. Used for versus effective for are two different things. So this is where you could have gotten a little tricky. Maybe you didn't think about this one. People often use milk thistle for liver protection and liver symptoms, but it can cause liver problems.
So for the milk thistle, it's used for liver disease and it also causes liver issues.
Yes. Who's vitamin D? You're moving up. Hey. What's fish oil used for? This one you should get. This one should be oh yeah. Quick go. Cardiovascular health, right? Yes. What is the mechanism of red yeast rice? Ooh, we've talked about this. Okay. Okay, so red yeast rice. Helpful for potentially cholesterol because it contains lovastatin in the structure of monocyllin K. What does butterbur prevent? I mean, it'd be great if it cured all allergies, right? So this one gave it away if you were fast enough. Butterbur migraines. Butterbur migraines. There's another butterbur question coming later. Home remedies. What's ginkgo used for? Okay, good. Seems that you've been paying attention. I appreciate that. So ginkgo, cognitive function and memory. Right? Oh, did you go too fast? Sometimes that happens. That's the tricky part of this game. It does not allow you to go back. Oh, you're coming in, Michael. Which supplement is often used for joint health may enhance effects of anticoagulants and increase risk of bleeding? This one you should get. Okay. If there's a G on the page and it says bleeding, that's probably the answer, right? This supplement used for insomnia can cause drowsiness and should be avoided with CNS depressants. We've talked about this one a lot too. Okay, so valerian, relaxation, GABA, over sedation, CNS depressant, avoid with other CNS depressants. So for example, if someone was going to take valerian and they're like, Doc, can I take diphenhydramine with this? What would you say? Please don't. Please don't. Okay. Oh, no movement. Multi-select, get ready. These supplements may enhance hypoglycemic effects of diabetes medications. Ooh, there's more than one. Okay, so we've talked about both of these. Diabetes associated alpha lipoic acid and cinnamon. These supplements should be avoided in patients with asterase allergy. Ooh, that is an example in the picture. Okay. So in this case, it's echinacea and milk thistle. Aloe can have its own allergy issues, but it's not an asterase plant. Aloe is which is also, what's the other name for those? A succulent. Yeah. Chondroitin. Chondroitin is one of the ones where the glucosamine and chondroitin come together for joint supplements. That's one of the ones that you want to be careful with. It's either fish, seafood allergy or bovine, like the bovine trachea allergy, or especially for vegan. This supplement should be avoided in people with chronic chickpea allergy. Ooh. Okay, so this was fenugreek. This one might have been tricky. This was a random fact thrown in there. Okay. Oh, no movement. This supplement has risk of serotonin syndrome when used with antidepressants and reduces levodopa efficacy. This one you might not know. Okay, so this is Sammy. We hadn't looked at Sammy yet. Select the supplement often used with statin medications. Ooh, you could have gotten tricked on this one. You went too fast. Okay. Reggie's rice was our tricker in there, right? Why? The lovastatin. If you just said statin, you would have been like Reggie's rice, but that's not what the question asks. Coenzyme Q10 helps support someone who is using a statin because of the proposed depletion of CoQ10 causing the muscles aches and pains. So that's why people will sometimes use CoQ10 with the statin, especially if they have those myalgias and myopathies. Okay. What does melatonin help with? This one could be tricky too. Oh. So I think the thing to realize is that melatonin is often used for sleep or for jet lag, but it's shown for lots of different types of sleep disorders. Is melatonin an endogenous substance or an exogenous substance? Endogenous. You have your own and make your own melatonin. What is St. John's wort used for? That's St. John's wort. Okay, this one should have good. Most people got this one. Depression, mild to moderate depression. Downsides, not a lot of people should use this for mild to moderate depression, right? Most people should not self-treat for mild to moderate depression. What does valerian help with? I got a lot of valerian in here, huh? Okay, good. What is ginger used for? Ooh, it's tricky. So it can be helpful with pain too.
What type of pain? Stomach pain?
No, just general pain. I had a lot of ginger and peppermint questions. Ooh, this one's okay. Good. You're paying attention. We just hit the halfway point too. This is a lot. Yep. What does alpha lipoic acid help with? Okay. There's a key word in there. What is your urethro used for? This one should be obvious too if you read them. Oops, sorry. Okay. What does panic ginseng help with? Okay. What's green tea used for? Okay, good. Yes, the caffeine. Good. If you have too much green tea, it can cause upset stomach. Don't do it. What does cranberry prevent? This is where you should be. You should all be to the point where you're like, I've got this, I've got this, I've got this. I think it was possibly effective for UTI prevention, but not treatment. Prevention. That's some of the times the wording is really important, especially when you're looking at those infective things. It's prevention versus treatment. Ooh, DHEA. It should. I didn't realize that the image that I used really helped you out here. Really did. So the DHEA is a hormone, and it affects your hormones significantly. There's another question about this later too. What does saw palmetto help with? Okay, good. You're also paying attention. Get ready for the next question. Same page, different one. Okay, so those were the two BPHs. There's another BPH one that we'll see in here in a second that I want to bring up. Those are the ones that we traditionally use for BPH. We think of saw palmetto and pumpkin. Downside of saw palmetto is people use it for BPH, but it is possibly ineffective. So supplements for BPH where the evidence is and the things that people have done. Saw palmetto is possibly ineffective. Pumpkin's possibly effective. And then fenugreek was another one with evidence for ineffectiveness. These just kill me. Like, this is... Ah. What is glucosamine and chondroitin used for? Part of me thought these might be really easy, but then I realized you really do need this quick recall practice. Good. You're getting there. I know. The picture. If you didn't look at the picture, look at the picture. Good. Oh, still not moving. See if we can get some of you. Double points. What is Sammy used for? I knew I had some more Sammy in here. Picture doesn't help. Okay, good. Anytime it says only, you probably are like, probably not it, right? Not effective for anything. So Sammy, osteoarthritis and depression. What does turmeric help with? Good. This is what you should be thinking. Good. See, look how much better you're doing now. This is so great.
There's a reason why. I realized it's too late. I wonder which one.
Okay, great. They do get trickier here at the end, I think. Ooh. Don't overthink this one. Okay. So tea tree oil is often also used for the skin. Aloe and tea tree are skin-based products. You don't want to consume them. At least tea tree oil, you can consume aloe. If you drink aloe, what is the thing that you need to be ready for? Well, it doesn't taste good. You are worried about allergies like topical dermatitis with aloe, but it could also make things move too quickly. Just go right through you. Acne and fungal infections, though, with tea tree oil. What? There we go. Good. You've caught on. Let's see. I think I end with these, like, what are these for? Okay. We have 10 more in the home stretch. This supplement is a known CYP3A4 inducer. You should know this too. Yes. Drug interactions. I went fast, sorry. This supplement for migraine prevention must be labeled as PA-free to avoid hepatotoxicity.
George, what is it?
It's not milk thistle. It's not milk thistle. So that the milk thistle was thrown in as your distractor here. Milk thistle is the one that's used for liver. I appreciate how into this you are. George, you got distracted by the distractor. This product may cause a maple syrup odor in the sweat and urine? Okay, good. Fenugreek. Yeah, fenugreek is often what is the flavor of artificial maple syrup. This supplement might worsen hormone-sensitive cancer. We've talked about this one already. You should know. Okay. So this was I'm glad a lot of you got distracted by my black cohosh distractor because you're thinking hormones and menopause. However, DHEA is directly related to hormones. Ooh. So this one possibly unsafe long term due to potential hormone effects. Common side effects include acne, insomnia, mood changes, nausea. May have serious side effects including increased risk of cardiovascular events and cancer. What is a safety concern associated with cassia cinnamon at high doses? Okay. So this is one where there's two different forms of cinnamon. There's the cassia and then there is the Ceylon. The cassia has higher risks of potentially containing a coumarin, which potentially could cause liver toxicity.
In India, they say that the other one is the real.
Is safer. Yeah.
We're getting like the.
Yeah. Supplement claims to be high in calcium. What type of label claim is this? New page. Okay, so this is a nutrient claim. Select the FDA's role in dietary supplement regulation. You know this. You know this. This is like the whole point of that thing you listen to, right? Taking action only post-marketing because it's a supplement. They're not FDA approved. They do not have to show that they're safe and efficacious. They just get reviewed after if there's reports on them. Manufacturer markets a supplement claiming it treats joint pain. What regulatory issue does this raise? Treats joint pain. Okay. Inappropriately makes a disease claim. So remember that supplements cannot have statements like treats, cures, because that is a drug claim, and it cannot make those types of claims. Supports, aids, not treats, not cures. Which of the following statements best describes the impact of Jeopady of 1994 on dietary supplements? So this one was harder. You had to take the time to read them. But this is basically saying the same thing, that the FDA They can be marketed without FDA approval. Deshay did a few other things too. It classified dietary supplements as defined what they are, established good manufacturing practices. Okay. Who is it? 5G. So this is Jesse, Ernesto, and who's Cam? Sean A. Ooh, look at that. That's so fun. Okay. Thank you for playing along with me. Hopefully, claim rewards. I don't know what that means. Hopefully, this was a good review for you all to practice these. I do want you to know that there's some questions posted, but they're from last year. So if you can't find the answer, it's because things changed. They just were auto-posted from last year's material. The thing that can be helpful, though, is the modality questions that are posted. Look at those. What other questions do you have about this material? Yes, you have the Kahoot. You have the Kahoot. Play the Kahoot. Yeah. Anything else?
So how do we wrap up this class?
How do you wrap up this class?
What's left?
You have the exam left. That's it. This is the end of it. This will be a good solid transition into the end of this course. So you have a few topics on the exam, everything that was past the second exam. So a lot of supplements and vitamins and cannabis. I think that's most of it. Modalities with me. I think that's everything. It's not meant to be tricky. Let us know if you have questions. Good luck. Yes, Jesse? It's everything past, I don't know it off the top of my head, but it's everything past we could look at it. Everything past exam 1. You're welcome. Hang on just a second.